and parasympathomimic agent, nicotine has both recreational and therapeutic uses. It is commonly consumed through tobacco products like cigarettes, cigar, and chewing tobacco, as well as through the electronic cigarettes and vaping devices. Okay, so in the clinical settings, nicotine is used in the nicotine replacement therapy (NRT), which is available in forms such as gum, dosage, transdermal patches, and nasal spray, which is functions to aid in smoking cessation. So, nicotine is rapidly absorbed through the lung, skin, and mucous membrane, and is also widely distributed throughout the body, including the brain, placenta, and breast milk.
For the mode of addiction, when a person smokes or vapes, nicotine will enter the body through the lungs. It quickly goes into the blood and reach the brain in just 10 to 20 seconds. In the brain, nicotine will attach to a special receptor called nicotinic acetylcholine receptor. This action makes the brain release a chemical called dopamine. Dopamine makes the person feel good, happy, and more alert. The brain remembers these good feelings and want it to feel it again. So the person keeps using nicotine to feel the same way. After some time, the brain changes and needs more nicotine to get the same effect. This is called tolerance. The body get used to nicotine, so the brain also start to depend on nicotine to feel normal. If the person stop using nicotine, they feel bad, anxious, moody, and crave it. To stop these bad feelings, the person will smokes or vapes again. This creates a cycle, which is when they use, they will feel good. If they stop, they will feel bad. That's why they will use again, which is lead to addiction.
Nicotine dependence. Nicotine dependence begins when nicotine from tobacco or vaping rapidly reaches the brain and binds to nicotinic acetylcholine receptor, especially in the ventral tegmental area. This stimulates the release of dopamine in the nucleus accumbens, creating pleasurable sensation like reward and relaxation. Over time, repeated use causes the brain to adapt by desensitizing these receptors and increasing their number, leading to tolerance. When nicotine level drops, withdrawal symptoms like irritability and craving occur, pushing the user to take nicotine again. The cycles of reward, withdrawal, and craving is what leads to dependence.
Okay, so next is what is tolerance? Tolerance refers to reduction in response to nicotine after repeated exposure, meaning an individual need more nicotine over time to achieve the same effect. This happens when there is continuous exposure, receptors become desensitized. So the brain compensates by increase the number of nicotinic acetylcholine receptors. However, increased receptors number, the overall sensitivity remains reduced. Thus, higher doses are needed to give same desired effect, leading to tolerance where the user gradually increase nicotine to feel the same stimulation, relaxation, and cognitive enhancements as before.
When a person stops using nicotine, like from smoking or vaping, they can experience withdrawal symptoms. These symptoms usually start within a few hours and peak in 1 to 3 days. Common symptoms when they stop using nicotine includes irritability like getting angry fast, anxiety, difficulty concentrating, restlessness, depressed mood, increased appetite, insomnia, and strongly cravings for nicotine. This happens because the brain has become dependent on nicotine to regulate their mood and focus, especially through dopamine release. Without it, the brain struggles to adjust, leading to both physical and emotional discomfort.
And lastly, the antidote treatment for nicotine addiction would be using varenicline. It is a nicotinic receptor partial agonist. It also partially stimulates the nicotinic receptors, thus reducing cravings and withdrawal symptoms, which are presented earlier by Sanjana earlier. And it also blocks nicotine from binding fully, thus reducing the rewarding effects of smoking. And that's all from our group. Thank you.